Hey everybody, I'm Tammy Kiefer. I'm a licensed clinical social worker.
And my name is Desiree Grimaldi. Welcome to Unguarded Minds podcast, where we talk about all the nitty gritty and drama and trauma that life throws at you. We have a special guest today, Don Donnelly. He's a devoted husband and father with a deep-rooted career in the medical device industry, focused on innovation for pain relief. His personal and most transformative journey began with his youngest son, Scotty, who was diagnosed with pediatric autoimmune neuropsychiatric disorder association with, and I cannot say that word, Streptococcal infection, also known as PANDAS. And today you're going to kind of walk us through what all of that means and talk about your book and your advocacy and your journey through it. So welcome.
Awesome. Thank you for having me.
Yeah. Thank you.
Yeah. So PANDAS is much easier to say, obviously, as an acronym.
Yeah. So what is PANDAS? Like, can you explain for people? I know that I looked into it. I know Tammy is familiar with it, but for our audience who doesn't even know what it is or have never heard of it, what is it?
Yeah. So oddly enough, it starts with something as easy as strep throat. And when you have strep throat, the body has a bacteria in. You feel lousy. You've got this sore throat. You feel like you have the flu. And just like everybody else, you're kind of laying in bed, kind of waiting for it to go away. But what the body's doing is they release white blood cells to go attack this bacteria. And that's called the autoimmune response that most people have. But for some people, mostly children, once that bacteria is gone, the white blood cells don't disengage. And they actually go after the healthy cells, still looking for something to fight. And as a result, you get brain inflammation, and you can have just normal symptoms. And then kind of the next day you wake up with extreme neuropsychiatric conditions.
I did read that it was sudden. It literally happens overnight. It's not something progressive that you would really see leading to that. Is that, so that's what you're saying is the case. It just.
Sorry.
Hi, doggy.
Sorry, we got a puppy for Christmas and he's in his pen. So yeah, so for us, it just started in 2020. Everybody was kind of going through their thing at that point. And my son, Scotty, had never been sick before. So he never had any type of fever. He didn't have any type of flu. He was just kind of lucky in that aspect, all the way for 9 years. And all of a sudden he was sick. He came down with a really bad flu. But what was weird is he was very lovey. He was very clingy. He was a lot of the things that he'd never been before. But 5 days went by, and he went back to being hyper, playing with toys, doing the things that he loves to do. But we started to notice changes almost immediately. It started with defiance. Something as simple as, hey, come do your homework. It was met with a really loud no. He also started to get really emotional about food if he wasn't allowed to eat when he wanted to. And it just started to drift. So after about a month, we noticed that that defiance turned to rage, and that rage started to turn to violence as the months went by. And, as parents, we really didn't know what to do. So, of course, we went to a psychiatrist, or not a psychiatrist, but a pediatrician. And the pediatrician said, hey, look, this is normal. It might be early puberty. It could be a bunch of things. But honestly, that kind of started our 2-year long journey of wondering really what's going on.
So how old was Scotty? You said he hadn't really been sick, and then all of a sudden he got sick. How old was he when he first got the strep that caused the ripple effect here?
He was 9 years old.
9. Okay.
Yep.
And then, so when he got sick and then he got clingy, as a lot of kids do when they're sick, that's the most cuddly times with my kids when they're sick.
For sure.
But then, how long did the psychological symptoms last? Did they kind of go away after a period of time? Like when your immune system becomes, intact or healthy again?
No, unfortunately for him, they never did. He was able to control certain things during the day. But the challenge was, and it seemed like it would always happen around 3 o'clock in the afternoon. That's when he would really start to binge on food. And for binging on food, it wasn't a psychological thing. It was an OCD thing at that time. He couldn't get enough. He thought he wasn't full enough. And, we just thought he was eating a lot because he was, a growing boy, or we were starting to fall in line with the puberty diagnosis. But he would honestly eat until he got sick, and then he would eat again. And at school, we started to notice that he was talking back with teachers, which he was always the teacher's pet. He started to become reclused, and he definitely never wanted to go outside. He had this fear that something was going to hurt him if he left the house. He started carrying keys around his neck, and he had a certain number he had to have. It was 22 keys. And if he had 21 or 20, the world was going to be out of order, and he was really fearful that something bad was going to happen. And these were all new symptoms. He didn't have any of these symptoms before. He was certainly very hyperactive. He was just like every boy that age, just very inquisitive and always running around. But that all stopped after he got sick.
And so I read it typically happens to children in that puberty stage. So with your experience and stuff, how many cases go undiagnosed because it gets brushed off as like a puberty thing, or a preteen? Or
that's my fear. I think it's grossly misdiagnosed, and the challenge is so the reason we got help was from a social group called PANDAS Parents, and this was after we've been through the 13 specialist. This is after we've honestly tried every type of therapy and drug for Scotty. And we found this advocacy group. Actually, my wife found it. And what we found out was these kids have very similar symptoms to what Scotty had. And as we started to talk to them, we're starting to hear just nightmare stories of what other children, really globally across the world, were up against. And you start to think about kids that you see that are doing, serious things in school that they hadn't done before. Or you start to think about kids that all of a sudden, maybe they rush a police officer because they're called to a domestic violence thing. And maybe kids that are just honestly put into permanent homes because their parents feel that they can't control them anymore. I promise you a lot of those kids have pandas. I can't put a number to it, but if I just can use my own journey, when specialist number 13 told us that we need to prepare for Scotty to have inpatient care on a permanent basis, that really stuck with us, because I can't imagine not having him in this house the last few years that we've had him since he's been healthy, because he really does mean the world to us.
And you're right, like the crossover between an anxiety disorder, ADHD, bipolar, even maybe schizophrenia, if you're thinking that someone's coming at you and you're rushing somebody, or, whatever, just the crossover of all of the symptoms. Pandas hardly ever comes up as, I wonder if it could be pandas.
It's really kind of sad. And, the first line of defense is always a pediatrician. And, pediatricians do a great job. We certainly love our pediatrician, but they didn't know what to do. And they referred you to a psychiatrist as always the next step. Well, if they're not trained in pandas or know how to identify that, they're going to be treated like a psychiatry patient. That means chances are they're going to have anti-psychiatric drugs.
Right.
So that's what I was going to ask. The primary care doctors, are they educated in pandas, or is that more of like an internal medicine, like specialty, or?
So it's a good question. If you look at pediatricians, a lot of them are kind of defined by either what the insurance says they can do. So, for example, there's not anything outside of the blood test that they typically do. They typically have their continuum of care. And if it doesn't fit within that, it might go to a specialist after that or be referred to a specialist. If we could educate pediatricians earlier on in the process, at least have them ask those questions Have they had strep throat recently? If all of a sudden these neuropsychiatric symptoms are sudden or onset after illness, these are questions that they could ask or throw into their continuum of care that could at least lead them down a path that it could be PANDAS.
Did they do blood work on Scotty when you first brought it to the pediatrician? Were they like, okay, let's run some tests and see what's going on? Like, at what point in the journey through your 13 specialists did somebody say, let's run blood work?
Unfortunately, it was when we were at rock bottom, though. At that point, COVID was in full blare. And, we were kind of stuck on what we could do because we couldn't just go to the ER back then. So we took a chance and we drove all the way to a hospital in St. Pete for children. After getting scolded for bringing him into the ER, they came in and they spoke to him. And, they gave him the line of questions that they give every kid. And one of those includes, have you ever thought about taking your life? And he said he did. And that's the first time we knew the limit of it. We knew exactly what he was going through. We knew he was struggling, but we never knew a 9-year-old could feel like that. And luckily, there was a neurologist that had heard that. He said, yes, we're definitely bringing this child in. And I hate to say this, but fortunately, my wife and him tested positive for COVID, so they both had to stay. And that's actually what kind of saved us. But there was a neurologist that believed in us. And just because my wife had done so much research, they honestly kind of geeked out together about what it could possibly be. And they came up with the diagnosis together.
Wow. So once you get the diagnosis, like what does that look like? Like, what is his life going to look like going forward? Because how old is he now? 14?
So he's 14.
Yeah.
He's 14. Right now, we do monthly infusions of something called IVIG, which also is a long one. It's intravenous immunoglobulin therapy. And
what's the
essentially
acronym again?
IVIG.
Okay. Sorry, go ahead.
Okay.
Go ahead.
If you take plasma cells from donors and spin them down, essentially it takes probably close to 500 patients to donate in order to get one dose, one dose of IVIG.
Wow.
When he had his in the hospital, they did it over 7 days. And you could see life kind of come back into Scotty's face as he was going through this. A lot of the symptoms that he had were gone by the time he left the hospital. And essentially what this drug is doing is it's resetting his autoimmune system, which is allowing those white blood cells to kind of disengage. Sorry, the dog's at it again. So it's allowing those white blood cells to disengage. And then the inflammation from the spine and the brain, from the brain starts to go down, and then he returns back to normal. I hate to use the word normal because every kid has their gifts and every kid has their specialties, but for the most part, he's just a great kid. He's got good grades. He's got a great sense of humor. He's a little quieter, and I'm not sure if he really knows what's going on or what happened in the past versus kind of how things are now. He knows he gets the infusions because it makes him feel better, but I don't think he remembers too much about the past. But his future, I have a positive outlook on it because it certainly could be as bad as it was. But my hope is that this therapy continues to make him better, and that's the goal.
So he gets regular infusions, whether he is sick or not, whether he has symptoms or not, he gets the regular infusions.
Correct. So
Okay.
it could be any kind of sickness that kind of brings him back into it now, as long as it's a bacterial infection. Now, that being said, we haven't had a flare probably in about 1.5 years.
Okay, so if no flares, no symptoms, then no infusion.
We still continue with the infusion.
You still continue. Okay.
Correct.
Yeah.
It's more like maintenance, right?
Yeah, we think so. He's on a low dose of it. As you get older and as you start to gain more weight, you can increase the dose. Mm-hmm. He's got a great immunologist that's really in tune with PANDAS that is kind of taking care of him. And, he'll decide kind of what the next steps are with that. I don't know if he'll stay on it the rest of his life. I really don't. But I could tell you for right now, it's working and he's improving from it.
Does insurance pay?
So
Is that
that's a
covered?
battle. It is very expensive. As you can
Yeah.
imagine, with all those donors, it is very expensive. So we do fight the insurance battle. If I ever switch insurances or, if it ends up falling off a plan, we do fight a lot, but we'll continue to fight. And that's kind of what led to where we are now and kind of why I'm talking to you. There are a lot of families out there that can benefit from just having knowledge about pandas and different treatments and things like that. If you do have something that's denied by insurance, I don't want to teach people how to do it. I just want them to advocate for their kids, because these treatments, although are expensive, they work, and we're living proof of it. And that's kind of why I wrote a book. That's why I'm doing these podcasts now. I just want to bring awareness to this disease and that there is hope. You just have to know where to turn.
Now, with the treatments and everything, is it curable or is it something that he will always have?
So he'll probably always have it, but it's my understanding as you grow older, you can start to adapt to it better. Also, with IVIG constantly resetting your immune system, the hope is eventually your body will figure that out on its own, or maybe you can walk away from IVIG therapy. But there are, simple treatments like antibiotics or even something, an anti-inflammatory like Motrin that can help at least bring the inflammation down. But the problem is that if they're being treated with anti-psychiatric drugs, they're probably making it worse because they're not treating what's actually going on.
So is there a spectrum? I've got a friend of mine who, her daughter, similar, she got strep and then all of a sudden had this behavior coming out that was very like defiant, and then her daughter would just feel horrible because she'd realize what she was saying to her mom and dad, and then she'd feel horrible and but she couldn't help it. And they finally went, got some help, found someone, had the diagnosis of pandas. To my knowledge, I don't think she has to do any of the infusions, but if strep comes on or she gets sick, she has to immediately get on the antibiotics, and then that brings it down, and then she's okay. But she only has to do antibiotics or treatment when she gets strep. Is that? And I think I'm understanding her situation right. Is there like a spectrum of intensity, I guess?
There is. When it's to the point where they're completely locked in their room or they can't engage in public, when they become so violent that you're kind of concerned about your own well-being or your family's well-being, that's when you probably have to turn to more of an IVIG.
Okay.
I think some people do have I hate to say controlled version of pandas, but maybe it's a version of pandas where it doesn't hit as often. Maybe it's a
Manageable.
version where it's kind of more OCD and they try to handle it by just treating the symptoms. There's still a lot of unknown on how to treat it. And I think that's where getting the medical community together will help kind of develop some type of treatment algorithm for that.
So were you involved in any kind of support groups or, yeah.
Every day. So I have my job, and then I have the job that I do for free, and that's being any kind of advocate for pandas. There's online support groups. The biggest one's called Pandas Parents. It's on Facebook. It is a closed group, so they'll ask if you have someone that has symptoms or something like that. But it's amazing as you get on this support group how many other families are going through this, and you could just feel families that are broken, that are knee deep into it. And then you can hear from other people like ours where we've kind of climbed out of it for the time being. And all they want to do is help the people that are going through it because they know what they're going through. There's thousands of people in this support group. It's a big deal. And I would say the majority of them, especially when they're first joining up, you could feel what they're going through. You could feel the depression, the fear, and the unknown that they're going through. I want to dedicate as much free time as I have to making sure that those families have some kind of answers.
And you said that it was Scotty's first time getting strep throat. Did you guys, when he got sick, did he go to the doctor and get a strep test immediately and get on antibiotics? Or because it was such a weird time with COVID, did you guys wait a few days? Does that matter? Like the severity of the strep, how long before it's treated, or how often they get it or don't get it? Does any of that play into it?
Oddly enough, it was, we remember it being the 5th of February in 2020. So it was, COVID was out, but it certainly hadn't blown up worldwide. But we remembered because he's never sick. And the cleanliness lasted, honestly, for a couple days. And that's when we called his pediatrician, maybe after that third day. Went in, did a quick rapid strep test, came back positive. I think he gave an antibiotic to make it go away, and it did. It went away in about 3 days after that, and life was returning to normal. And it was about a week after that that we started to notice first symptoms.
Wow.
So in the treatment process, they do that IVIG, and for him being 14, and is he also learning coping mechanisms for the anxiety, the OCD, the agitation, the irritation? Is that part of the treatment?
It is. We've got a great psychiatrist that we still work with that's very PANDAS friendly. He's referred us on to social workers and therapists that know exactly what to deal with and the questions to ask. He's very reserved. He's quiet unless he knows you. So he's got a really good team that's allowed him to kind of open up and talk about it. But so far, his OCD it's okay. He still likes to carry keys every once in a while, and every once in a while we'll notice a different tic that he hasn't had before. But for the most part, it's nothing compared to how it was.
Does he know that you advocate and hear you talking in groups and stuff?
He does.
Yeah.
His name is not Scotty. I love that name, so I just decided to give him that for a pseudonym. But he knows about the book. He knows I do podcasts. He knows that I'm advocating on his behalf. My next goal is locally. I'd like to talk to teachers because they're kind of the first line of defense in advocating for this, and they notice this stuff. They'll notice changes in kids that maybe the parents don't. And if maybe they can recognize it, then we can start to make people get diagnosed faster. And from there, eventually, I'd like to make it to family practice groups and just sit down and talk with them. And let's just find out, let's just have a discussion what we truly know about it and how we know how to at least identify these types of patients.
So do they ever do a combo? I know you said if they're on psych meds, it can make it worse because they're treating the wrong thing. But once they identify it and are treating, even with an infusion or an antibiotic or whatever, can psych meds be helpful in combination?
In his case, absolutely not. I mean, it actually made things a lot worse.
It did make
the
it
violence
worse.
that he had became more violent.
Okay.
And it could be something like going to the store and, hey, Dad, can I have these Skittles? No, we're about to have dinner. Let's go home. And then I'd turn around and get punched in the back. And it's just something that quick that would set him off. Just about every one of the times where it was severe, it was because he was on high doses of those.
And so I guess it's definitely working as a team and having the physicians, the psychiatrists, the nurses, the social workers. Yeah, you've got a whole team who looks at individual cases to say, here's what we think is best. But yeah, working in a team of people who are familiar with it, with PANDAS.
Yeah,
it crucial.
Took a while to find that team. Right now, we have a pediatrician that's separate from his normal one. That's more of a holistic pediatrician. He looks to treat, underlying causes of what can make him have strep throat, or he kind of thinks outside the box as far as treating the symptoms. Then our immunologist is probably our main contact for PANDAS. He's fantastic. He's allergy and immunology, but he always says, I'm immunology with a capital I and a little a, because he really doesn't do a lot of allergy. And he sees extreme things like this. And it may not be just pandas. Pandas is just one branch of PANS, which is when you look at any type of thing that can trigger a neuropsychiatric condition in your autoimmune system. So it could be mold, it could be Lyme disease, it could be Bartonella, it could be all these things could cause it. Pandas seems to be getting a lot of movement right now just because it really is affecting 1 in 200 kids.
Okay, that's interesting I didn't realize that was the umbrella with mold and Lyme.
So obviously kids get strep often. My son, he had it for 4 months. Like, he's allergic to every antibiotic except for one, and it took us 4 months of trying to do antibiotics to get rid of it. But what would you tell parent, like, if our audience listens to this and their kids get strep, so that they don't like freak out and like run to the doctor and think that their kid has it? So we know to watch for certain things, but those could be puberty too. What would be your recommendation for parents who are nervous about that after their child has strep? Is it as simple as just asking your doctor, can you just run a blood test to be safe? Or like, what does that look like?
Yeah, so I think strep throat was diagnosed over 350,000 times in the US last year. Now, granted, that's adults, that's the whole gamut of people. The biggest thing I would encourage them is if you see a sudden onset or a big change in your child after that, don't wait. Go to your pediatrician. It's okay to be paranoid after watching this podcast or reading the book, because it is real. And I think if you can treat it quickly, you won't have to go through that same challenges that we did.
And so also, just piggybacking on what Desiree said, did you say there is a blood test that they can go in and test to see if that is part of is a diagnosis?
So there's not yet really. Unfortunately, a lot of it is post. A lot of it happens after you get pandas. There's not a lot you can do leading up to it. So the first thing they're going to ask is they'll do a strep test, or they'll ask, have you been diagnosed with strep throat in the past couple of weeks? And then there's, outside of that, there's not a lot you can do. There is a gamut of stuff that you can get that was put out by the Aspire PANS Pandas group, which is starting to work up a protocol for patients like that. But as far as early diagnosis and things like that, it really has to go off of parents, off of teachers, off of anybody that recognizes that something's changed in these kids.
Can adults get it?
They can. So if you get on this group, you will notice that there's 20-something-year-olds that are on the group. And what's kind of cool about their perspective is they're sharing their own examples. But they do struggle with it at times. Or you'll see a parent that's still taking care of their 20-something-year-old that does have it. It is rarer than kids, but you do have some that still do have it.
Do you think that it's possible that they got it when they were younger and it just progressed to show more as adults?
It can, or maybe they've been treated as a psychiatric patient this entire time until they finally recognize that they had it in their early adulthood, and now they're treating for it. That's kind of why we're continuing with IVIG now, even though there's not a lot of clinical support showing long-term use of it. My fear is what does happen when he's an adult. So if we can start working on the immune system now and treating that, and we're getting the results, and there's not a lot of risk associated with it, outside of cost, of course, healthcare cost, then I'm game. I want to keep doing it until the doctor tells me it's not good.
Yeah, I think, I'm all about advocating for yourself, for your kids. I think that that's your job as an individual, to not just wait for a doctor to bring something up, but to be proactive and really, really advocate for yourself. I think that, I could see a lot of our listeners getting a little paranoid of like, oh my gosh, did this happen? And I've got a teenager and they're acting, erratically, and they're defiant but like I said, I mean, there's so many of the symptoms that could that parallel each other. So But I think that, advocating, going and talking to an immunologist, listening to, reading your book, even just bringing it up with pediatricians. I think that hopefully, I'm hearing more and more about it, and you're advocating, and there's groups, and hopefully pediatricians are also educating themselves with, okay, let's look at this and consider, is this an issue? Is this something that, we can look at? Do you feel like that is healthy way of thinking about it? Just,
Yes, we have to talk more about it.
yeah.
The challenge is, I think people are afraid, well, if we talk about this now, when your kids are kids, eventually they're going to be adults, and maybe they're going to be tagged, because we're having this conversation about them. If nobody talks about it, we're not going to go anywhere with this.
Yeah.
So we have to share our stories. We have to share what challenges we've run across so other families don't have to go through it. And we can do it in a way that's healthy for our kids, but we have to talk about it. Otherwise, nothing's ever going to get resolved.
Absolutely. Yeah.
As an ingredient household kind of person, so away from the medical stuff, did you guys like change diets, like limit certain things that you found like made it worse or better? Or because like for ADHD symptoms, you cut out red food dye or things like that that really help somebody. So were there like things in your house that you guys had to adjust, or ways that you ate that kind of help support the immune system or the process of all this?
I think we've tried everything, honestly, at one point or another, especially, as we're trying to find those answers. We definitely are pretty strict about his diet. We definitely stay away from all dyes. We talked about the Skittles. There's nothing that says dye more than a big package of Skittles. But honestly, those are the things kids love. And we tried to keep him away from sugar for the longest time. And we still, tell him that it's probably best if he doesn't have it. But he's 14 now. He needs to figure out to make these decisions on himself now. And he's doing a great job doing that. Other than that, he sticks with a fairly healthy diet. We may sneak into his room or wake him up for school and find a bag of chips in there or something that any kid will have. And to be honest, it's not affecting him that much. But at one point, I think we've tried everything.
And do you have him on a lot of vitamins, like vitamin C, or daily, just to keep the immune system?
Yeah, his pediatrician that really studies a lot of holistic treatments is very big on vitamin D. He does take a multivitamin probably every other day. We don't like to, hit him with too much. We'll go get an infusion every now and then. I like to do that too, where he just kind of resets all his vitamins, just, if we're sitting around on a Saturday and maybe I'm starting to feel a cold coming on and he wants to go because he doesn't mind needles or any of that stuff. He'll go hang out in an infusion chair and get a multivitamin kind of put in. And he's really involved in his treatment now, and he wants to do what he can to stay healthy as well.
So the name of your book is Navigating PANDAS, the family's journey to healing and advocacy. And then you mentioned some Facebook groups, support groups that you have, and you have a website, right?
Yes.
Navigatingpandas.com.
Mm-hmm.
Do you kind of cover all the resources in that book for people, or?
There are so many more. The book was really just kind of me doing as much as I can to help people that are readers that will Google something, a book they can read first before maybe they go to a specialist. But as it can actually be overwhelming if you get on these parent support groups, what they've tried, what hasn't worked. This Aspire PANDAS site is really just a bunch of thought leader immunologists from around the country that they focus completely on literature. And you'll see all the active studies. You'll see the ones that have already been out and that are in peer-reviewed published journals. They talk about treatment. They talk about educating at the pediatric level, which I'm trying to do from my end. And It's still very non-well known, and we need to get their name out there more. But it's they've done a good start as far as putting together the right kind of clinical studies so that we can fight the payers, which is the next step.
Is that book available on Amazon?
It is. You can click on Amazon, or you can just go to navigatingpandas.com, and there's a link for that as well.
Great. Good. Well, thank you so much for coming on here and absolutely getting the word out, and just putting it as another resource and tool for parents who are struggling with kids displaying symptoms of PANDAS, and definitely something to rule out if they can and get the treatment as soon as possible.
Yeah.
Well, I appreciate you letting me talk today. It's very important getting the word out, and any help that we can get to do that to help other people, it is greatly appreciated.
Absolutely. And we're going to link everything in the description for our audience so they could follow you on Facebook, go to your website, and just get all the resources and share what you're sharing with them.
Awesome. I really appreciate it.
Yeah.
Thank you so much, Don. It was nice to meet you.
Yes, nice to meet you as well. Thank you again.
Okay. Take care.
Okay, bye.